Hey, syphilis cases in the U.S. have increased by 80% in just the last 5 years. That's the new finding of a report released by the Centers for Disease Control and Prevention last week.
Yeah, and the Houston Health Department, they already declared a local syphilis outbreak last summer due to a 57% rise in new infections between 2019 and 2022. Dr. David Pearce, Chief Medical Officer for the City of Houston, is joining us this morning to discuss this sexually transmitted infection. And Dr. Pearce, since the outbreak was declared, how's the case count in Houston? Did it get worse or has it gotten any better?
Yeah, so, it continues to get worse, unfortunately. And, we see this. I've been around a long time in Houston, and we see these waves every, several years. We'll start to get an outbreak, then we get it under control, but we never seem to get rid of it totally. And then it starts coming back again. This is a repeated problem that only, those of us in the community are going to be responsible for stopping if we could ever do it.
Yeah, and how does syphilis spread in a community?
Yeah, so syphilis is a really sneaky sexually transmitted illness. And the reason I say that is that the first stage, first of all, syphilis is unique in that it has several different stages of illness. And the first stage is when someone will develop what we call a chancre, and it looks like a sore. But the problem is that it's not painful. And so some people can have these sores and they don't even know it. And so then when they engage with sex with a new partner, they're transmitting the illness to the other partner without necessarily even knowing it. So that's the first stage. The second stage, which can occur months later, is when they develop a rash on their, on the body, but predominantly on the hands and the palms and on the bottom of the feet. And guess what? This rash doesn't itch. And so that is highly infectious. So by virtue of the fact that syphilis causes these skin lesions that don't hurt and they don't itch, people don't always pay attention to them, and so it spreads.
Wow, but that rash on your hands and feet, it can't be spread that way. It's strictly sexually transmitted, correct?
No, the rash on your hands and feet can be infectious too.
Oh, wow.
Yeah, so fortunately, most people will actually see the wound. I'm going to call it the chancre, and hopefully it will get their attention. They'll go to a doctor, and then we can, give them the antibiotics and get rid of it. And here's the other thing is that, syphilis can be treated. And the treatment is actually pretty simple and straightforward, but you got to treat it early.
Okay. Who else should be tested then? If you don't know, if you don't have a rash or you don't know to be looking for this, who would you recommend gets tested for it?
Well, the things that put you at risk for syphilis, as well as other sexually transmitted illnesses, include having unprotected sex, sex with multiple partners, sex perhaps with a new partner. There's some, anonymous sex. And then also if you're having sex with somebody who tells you they were recently infected and perhaps even treated for gonorrhea or chlamydia, or someone who's got HIV, because these illnesses, these infections, they tend to run in, if you're at risk for one, you're at risk for the others. So the other thing is that pregnant women on their initial prenatal visit, and then again in the third trimester, they always get tested. It's a standard medical practice. It's also required by law, because the bacteria can be transmitted along to the baby. And so we try to catch that with pregnant women so that the baby doesn't become infected.
Is it dangerous to babies or a pregnant mom?
Yeah, so it is absolutely dangerous to the babies. There's a number of problems that can come up with the baby. They include, problems with lower extremities, neurologic problems. You can have the miscarriages, stillbirths, early, low weight birth. There's all kinds of problems that can come with for babies that get infected unknowingly, of course, by mom.
Yeah, and you mentioned that the treatment was pretty effective if diagnosed. What is it? Is it a pill? Is it medicine?
It's antibiotics, generally in a pill form. And like I said, it's highly successful. I mean, some people will have a reaction. They'll don't know they have an allergy to that medication, so they'll have to work something else. Some people get reinfected. That's the other problem, is that if you get infected and you realize it and you treat it, but your partner doesn't get treated, you're just going to get reinfected again. And so we see that. So we see a recurrence. That's not a failure of the treatment. That's the fact that people get reinfected.
Yeah. Is there anything that people should do that you would wish people would do to lower their risk for spreading syphilis?
Yeah. So, first thing is, if you're going to have sex, have, safe sex, which means the use of a condom. Also, limiting your sex partners. Not having anonymous sex. These are the things, these are the basic things we've talked about before to lower your risk from sexually transmitted illnesses. And, today we're talking about syphilis, but whether it be chlamydia or gonorrhea or HIV, all these sexually transmitted illnesses come with their own set of unique problems. And really, you don't want any of them, right? So do what you can to protect yourself from getting any one of them in the first place.
So is the health department doing anything specific since you guys have noticed this increase?
Yeah, we are. So one of the things we're doing is we're working with great folks like you to try to get the word out so people will, start paying a little bit of attention to, if they have these chancres. It looks like it would be a really painful sore, but it's completely painless. So that's one thing. And if you have a painful one, that's a different type of sexually transmitted illness. So anytime you get something in your genital area that doesn't look right, go see a doctor. Now, one of the things you can do is you can call, our health centers are treating people with sexually transmitted illnesses. So you can call 311 or 832-393-4220, and we'll find you a health center near where you live where you can go and get treated. We've also got a mobile clinic. And again, if you call those same numbers, our mobile clinic may be in your neighborhood. And so that'd be another way for you to go ahead and get treated.
Yeah, that's great information, and it's right there up on their screen right now. And of course, we will clip this interview and put it on click2houston.com so that people can see it and they can go back and get that information. Thank you, Dr. David Pearce, for joining us this Monday morning. We always appreciate having you.
Thanks for having me.